I'm happy to be here because I really want you all to see how easy it is to test those water lines, all right? So I work with a high risk population. They're medically compromised. And as Dr. Rowling mentioned, elderly, they are, increased risk for that aspiration pneumonia. So when I got my new to me unit that had a lot of water lines in it, I thought I better test this because I don't know where what it's been through before it arrived to me because I bought it used. And so I tested the lines with this Clear Confirm test and they failed. And so I went through the process of, treating and testing. And mine, because I bought it used, it did not come with instructions for use. So I reached out to the manufacturer, said I've acquired one of your units, send me all of the directions. And my directions say that weekly I am to do shocking with bleach and water ratio. You want to make sure it's at the right ratio, they said. And weekly, I treat my lines. Even when I'm not using my unit, I am treating my lines. And that's really important because when they sit, then things grow. If I'm using my unit, then things don't grow. So I want you to see how easy it is to test, how quick and easy it is. So I'm going to show you the Clear Confirm test. What you're going to see here is they're going to take a sample of the water from the unit. And they're going to put it into this syringe. They're going to filter the bacteria through, take a little saline solution to kind of dilute it, and then they're going to put it into a gold nano silver particle suspension, and you're going to notice a color change, and that's how we know if our lines are good to go or if we need to do something more with those. So here's this short video for you to watch just so you can see how testing works.
Collect 20 milliliters from the water source to be tested in a clean container. Attach the filter tip to the syringe. Slowly pull back plunger and draw 10 milliliters of water sample into the syringe. Do not draw the full 20 milliliters of sample water. After drawing 10 milliliters, pull filter tip out of water sample and then pull plunger back, filling syringe completely with air. This step is essential to ensure accurate results. Remove filter tip from syringe and empty syringe by slowly pressing down on plunger. Discard this water. The filter tip contains the water sample to be tested. Remove the blue cap on the saline solution vial. Reattach filter tip to syringe and place the filter tip into the saline solution. Pull back the syringe plunger and draw in saline solution. Then, push the plunger up and down 3 times to ensure the saline has been mixed with the sample water droplets inside the syringe. Pro tip: the key during this step is pulling and pressing the syringe plunger slowly with light pressure back and forth. You should feel a little pressure while doing this step. Make sure the syringe has been completely emptied into the vial. Remove the cap of the test vial with the pink liquid. Place cap face up so inside of cap does not contact any surface. Empty all of the mixed saline solution into the test vial. Do not touch inside of the test vial. This could contaminate the sample. Recap test vial and write date and water source location. Let test vial sit at room temperature. Wait 15 minutes. Then, compare color of the test vial with this chart. Pink means the test found less than 500 CFU per milliliter and you have clean water. Purple means the test found contaminates between 500 and 2,000 CFU per milliliter. And clear water shows the test found over 2,000 CFU per milliliter and your water is highly contaminated.
Okay, so you can see there how that test works. 15 minutes in office, you're looking for a color change. We're going to go over some of the other tests that are out there and available for you, but this particular one from Clear Confirm, this comes from a water testing agency. They test water all across all of, a lot of different areas, municipal water, cooling towers, agricultural, hotel. So they are pros in water testing, and they have made one specific to us for dentistry, which is awesome. Really making it streamlined for us to be able to test it quickly in our offices and to identify those specific microorganisms that are problematic, that like to grow in our particular water lines, like these ones here. So this test is able to detect a lot of the, ones that Dr. Rowling had talked about, the more virulent ones that are really problematic for overall health of ourselves and for our patients. Not all tests even identify that Legionella that you can see listed on there. So that's one that this one identifies. Also the non-tuberculosis mycobacteria, it takes 30 days to grow. So if we need to get back to work tomorrow, we don't have 30 days to wait and grow this bacteria and nurture it to see if it was in our water line. So it's too long. So they've come up with a quick and easy test that gives us the information, allowing us to know if we have something. It doesn't specifically give you which one it is if you fail, but we know that some or many of these virulent ones are in our water lines, and then we need to go treat our water lines once we have that information. So fast, easy to use, and as you saw, very highly accurate. And I myself, we usually have a weekend to get things back in order, right? So we don't have days and days on end. So it's really important. We all know that we're really busy and we don't have time to wait to get going. We want to know within 15 minutes what our treatment needs to be so that we can get back to work for our patients and our operatories back in action. So with that, here is a list of several of the options that you have for testing. Obviously, I showed you the Clear Confirm video earlier, but it's important to know that there are other tests that are out there that might also work for your practice, or some practices use a mixture of a few of these together. So you can see down here at the bottom of the screen, those that are in blue are ones that you're going to mail in. Usually you have to package these in some type of like a dry ice, and you have to put them through the mail, and they go through the mailing process, and then they are cultured, and then you get your results. The pink ones on the far right, these ones are incubated, taken at room temperature and tested immediately. Essentially, as soon as you get your water that needs to be tested, they're working at room temperature, and pretty easy, quick results for those. Very important with each one of these that you follow the instructions to a T, or you could get results that you don't want to get. So very important with that. So on our next slide here, of course, we want that quick turnaround time. It can help us avoid costly downtime and closures of our operatories, avoid that liability. Dr. Rowling was talking about that. I do not ever want to have anything from my water lines cause anyone a disease or tooth loss or whatever it might be. It is so important to be testing our water lines. So with that as well, let's look at the bottom here, because it talks a little bit more in depth about this particular Clear Confirm test. So you're going to see with like the blue ones, you're going to get a list of maybe some of the bacteria, depending on the test that you use. You're going to get how much is in your sample, how many colony forming units that you have. On the right hand side, you're going to either, if you do like a dip paddle test, you have to count how many colonies are on that little paddle. Some are a color change, and you can see here that the Clear Confirm that we talked about earlier is a color change. And very important, like the video mentioned, is that we want to start pink and we want to stay pink. Pink is good. Pink is where we want to be. But I always think of it, if it turns clear, which is what happened to mine, within 15 minutes it turned clear, and I could definitely tell that I was not in the clear with my water lines. I had over 2,000 colony forming units in my water lines that needed to no longer be there, especially as I was going to go treat some of my elderly patients. Okay, so very important. So looking more in depth at this test, on the upper right here, you can see the pink, and what it has in it are these nanoparticles. They're called functionalized gold nanoparticles in this suspension, and it works through what's called rapid cell wall recognition technology, and that's where they recognize these harmful microorganisms as these little gold nanoparticles attached to the bacteria. And as they do that, you get a solution and a color change. So in the upper right, if there's no bacteria or very minimal bacteria, less than 200 in that sample, then everything's going to stay pink. There was nothing for it to interact with. On the lower left, if it starts to turn a little shade of purplish, we know that we are between 500 to, but a little bit less than 2,000 colony forming units. And even in this test, if it's purple, we know that we are above that recommended amount. So we would definitely want to be treating those water lines. On the bottom right here, we're not in the clear, right? So those nanoparticles have been all used up by the virulent bacteria in the sample. And so, once they're all used up, they go to clear. So with that, the Clear Confirm, as I mentioned to you, acts like a little antibody. These little nanoparticles act like antibodies in our own body. They don't wait for the bacteria to be attracted to them. Instead, they're actually in that solution actively searching for bacterial cells. So once the bacteria get detected, those nanoparticles will go attach themselves to those bacterial cells. And then, if there's a lot of them in there, we're going to see that color change. Now, a culturing method where it's grown in a lab, they try to attract and feed the bacteria until they get large enough to form visible colonies, and then those colonies are counted. The challenge with this is that not all bacteria are attracted to the same food medium. So we have several bacteria that we have in our water sample, and they don't all grow at the same time. They don't all like that particular food that we're feeding them. And so we could get highly underestimated colony forming unit counts when we do testing like this. Now, as I mentioned, some people like to mix and match some of these tests, and you'll have to decide what's going to be best for your practice. So do they compare? Like, is one, better than another type of thing? Or like, is one more accurate than another? I want it to be very accurate. They did a white paper and proposed some of the research on this, and they found that the Clear Confirm tests were consistent with the results obtained through the laboratory HPC method. So where they're growing it in the little petri dish type of thing, they found that they were consistent with that. So you can be feeling good that your results will be accurate when you're testing with the Clear Confirm test compared to that HPC method. Also, a little story here. This is the one that Dr. Rowling said. I always love hearing this story because it is pretty gross. So the very first office I ever worked in, I started with using a piezo. Now, it had probably been there 15 to 10 years before I arrived, so it was a little bit old. And but I used it because that's what was in the practice, and I did my daily flushing of the lines. And at that time, I graduated in 2008. We weren't doing much testing or shocking of the lines. Probably 5 years into working there, we finally did start putting a little tablet in the water bottle, which was great after this experience. So one day my piezo stopped working, and we had to call the repair person, and I'll never forget, he opened up the water line and he just squished out this long brown worm into the garbage can. And he said, "That is biofilm." He said, "You need to be flushing your lines." And I was like, "I've been flushing my lines." But there's much more, obviously, that, I needed to be doing with the water lines. Now that I know better, right? I needed to be shocking and treating those water lines in different ways and more often. And I never even read my instructions for use on my unit. And so now I do things much differently. But this is a case study that talks about some of the differences. You can see here on this where it's kind of circled pink below, in particular the cavitron. Okay, it says actually in this particular case study, they found that the Clear Confirm was even more accurate than the HPC. That's because when we have to start packing things on ice, even within minutes, that sample that we have taken can potentially change. We have to ship it, it gets bumped around, the ice melts, it has to go through the lab and be cultured. So in this particular case study, in the HPC look, they only found about 477 different types of, a bacteria. But you can see on the far left-hand side here where it's circled, they found a lot more in the cavitron. And so the counts in the sample tested after 24 hours had decreased significantly on those HPCs, in some cases up to 90%, and we want the most accurate, results instantly, as quick as possible for our practices and for the safety of us and for the safety of our patients. You can see here that it found 152 species, right, in our Cavitron, compared to the other ones, like our air water syringe down there below. They didn't find quite as many. And why do you think that there might be more species found in a Cavitron than like our air water syringes? Well, we're not using them as much. We're not flowing water to disrupt those biofilms. The water moves through them a lot slower. And so when we have a fail on our units, oftentimes it's through those that don't get used as often, ones that where water moves a little bit slower through. And so you can just be not so worried that you're not getting accurate results with something like this. So keep that in mind. We also want to make sure, we're testing anything that water flows through. So our Cavitrons and, a new big one here is our air powder polishers, especially the ones that have a little heat to them. Those love to grow bacteria. When you add heat to anything, we obviously know that it likes to grow a little bit more quickly. So not all bacteria grow at the same rates. So if we test at low temperatures, it takes a longer time to incubate. And if we test with high temperatures, then we might miss the slower growing bacteria. So it's really important, to consider what test is going to be best for your practice. So this one, a few quick, simple steps. Lab testing requires some shipping sometimes refrigeration, and it's great to be able to get really accurate results when you test immediately, same day in the practice. So when are we going to test our unit water lines? This little handout here is from Hager, and it mentions that you need to have some type of system to monitor and go, through, document your testing, okay? Very, very important, especially if there's an issue that does come up. You want to have record that you have been testing and that you have been shocking those water lines. So what you're going to want to do is obviously always follow your manufacturer's recommendations. If there are none, then you can follow these recommendations from Hager. First thing in the morning, you're going to go in, you're going to flush your water lines that you're going to test for 2 minutes. Disrupt all of that biofilm that's hanging out in there. We want to get a sample that we might actually use on a patient, right? And then you're going to get that water sample from everything that has water, okay? So let's say, for example, we're going to test our air water. So we get a sample of that and we follow the directions on how to test that. You do that with like that video that we saw earlier. And then if you pass, you're going to keep shocking according to your manufacturer. Once again, mine is that once a week with a sodium hypochlorite solution. And then you're going to continue testing quarterly, making sure that one of those is within the warmest month of the year in your area, because as we know, when it's warmer, they like to grow a little bit more. Now, if you fail, you're going to shock and test your lines, and potentially, if it's still failing over time and time again, then you can always ask your manufacturer for a new line to be put in. So keep that in mind, that that's a possibility. But if it continues to pass, your lines are doing great. And then you're going to test monthly for 3 months in a row until each of those pass, and then you can move to that quarterly, okay? Now your testing, just a reminder, might be set up by your regulatory guidance. There's some states that do make you do testing at certain phases and at certain times. So make sure you always check with your state. And a reminder that the ADS does recommend testing monthly until you have 2 consecutive passes. So that one I mentioned to you earlier said 3. So, you might find some different sources say different things, or your recommendations might be slightly different. So make sure you're doing your research and you're knowing what's going to be best for your office and for your operatories. Sometimes I always get a question about a pooled sample, so I did want to address that. So for example, there's some states who say like you can take up to 10. I haven't found any of the data on why they said 10. I've been doing some research on that. I can't find where that is, but from that same unit, they said you can take what's called a pooled sample. So what a pooled sample is, you take some from this air water and some from this air water, and then you test that. If you pass, then both of those are good. But what if you fail? Then you don't know which one, was the failed one, and then you're back to retesting those ones again with separate tests. So testing, each water line will let you know what's going on with each individual water line. It could just be if you miss one and it fails, that could be the one that's causing the contamination or the Legionella or the infections or whatever it might be. So really important to set up protocols within your office, follow those protocols based on your manufacturer recommendations, and test those water lines so that you can be sure that you're providing safe water for yourself and for your patients. This is a little waterline monitoring schedule. You can print this out. You can keep this in your infection control documents. There's some that allow you to do some track this, I should say, online. So there's a lot of resources out there for you when it comes to documenting these and keeping that record. But to end here, I just wanted to remind you of this study. 78% of microbiota in this particular study, in the aerosol, they came from the dental irrigant procedural water, not necessarily from the patient's mouth. So we are too breathing in aerosols all day long with our patients. And so if our lines are safe and working well, it's not only just for our patients, but it's for us as well. So be monitoring those. You're welcome to reach out to me, to Hager, Dr. Rowling as well, if you need some guidance on testing your water lines. We would always love to help. So I would love for you to get a free sample and go, once you get it, and test your first water line in your operatory and see what's going on. You can always reach out to me, care@shelly.dental. And once again, she has posted that link for you to be able to get that free sample. Thank you so much for having me on today. I'm going to click stop share and see if we do have any questions, Dr. Rowling.